Welcome back, beautiful tri-state area. You're listening to A Moment of Zen right here on 710 WOR, the voice of New York, iHeartRadio. I'm your host, Zen Sams. Happy New Year and welcome to 2025. Welcome to another Going Deep segment brought to you by CO2 Lift. In our Expert on the Microphone series, today we're joined by Dr. Jamil Ahmad, a renowned plastic surgeon specializing in aesthetic surgery and rhinoplasty with over 5,000 procedures performed since 2010. He's served in many prominent leadership roles, including assistant professor at the University of Toronto, VP on the executive committee of the board of directors of the Aesthetic Society, president of the board of directors of the Rhinoplasty Society, and he's also authored more than 180 articles and chapters, and he's given over 500 lectures globally. He's definitely a key figure driving innovation and education in plastic surgery. He's going to join me today to discuss how he helps patients achieve natural-looking results with reduced recovery time following facelifts, flap surgeries, and rhinoplasties, and how CO2 Lift is at the heart of it all. Welcome to the show, superstar.
Hey, Zen, thanks so much for having me on. It's really a pleasure to spend time with you today.
So honored to have you. Expert on the microphone, supercharged. So you certainly have an impressive list of accomplishments over a wide range of cosmetic surgeries and are sought after for your expertise and really just delivering that natural result. So let's talk about that. Many patients today prioritize natural looking outcomes. How do you manage patient expectations and ensure that your approach aligns with this goal of achieving this refreshed, but still keeping that authentic appearance?
Zen, I think that's a really great question. Getting a natural appearing result is imperative, at least in my mind. And I think communication forms a foundation for a good relationship between a plastic surgeon and his or her patient. I think the surgeon needs to communicate both what the options are, what the upsides, the downsides are, what the most likely outcome is, and what potentially negative outcomes can be. And I think a patient also has to communicate clearly what they're hoping to accomplish from a treatment. And I think you need honest communication. The other thing that helps a lot these days, I think, with the internet and social media is there's just so much more content out there that patients can research and get an idea of. And that's good and bad because there's some very good, accurate, honest content, factual content. And then there's also content there that can be misleading, potentially not present things as they are. And I think it's important to have that discussion so that a patient can really understand what's real, what's a real expectation of an outcome from a surgical or non-surgical treatment.
Well, that's put perfectly into perspective, and you're 100% right. It's all about communication, realistic expectations, and more importantly, managing those expectations, because I'm sure patients are coming in with pictures saying, I want to look like that. And that's not always realistic, right? Now,
Yeah.
let's shift to the recovery process. So before patients can see these natural results in full, they must fully heal, and downtime can differ from procedure to procedure. But one thing that we know can significantly decrease downtime and enhance procedure results across the board is CO2 Lift. And we're talking about CO2 Lift Pro, which is the strongest version of this non-invasive carboxy gel, and it can only be provided to patients by medical professionals like yourself. But before we dive into how you use it on your patients, can you describe the application process and how CO2 Lift functions on a cellular level?
It's very easy to use. It comes in 2 packets. You open the packets, combine it, mix it for about 30 seconds. That activates the gel. And the gel is applied to skin, and carbon dioxide then diffuses through the skin into the skin and the tissues just below that. And carbon dioxide does a few things. When you think of healing and what wounds need to heal properly, oxygen is a major component. That's basically powers all of the metabolism in a cell. And how does oxygen get to the tissues? Well, it gets there through blood flow and through blood vessels. And blood vessels are very reactive. They can get tighter or they can get looser. And obviously, when they get looser, and it's called vasodilation, then there's increased blood flow to an area. So CO2 or carbon dioxide causes vasodilation in the small blood vessels, and that increases blood flow. The next thing it does is that within the blood and within the red blood cell, there's hemoglobin, right? And hemoglobin's a protein that carries oxygen molecules in the cell. And hemoglobin is very responsive to different things in the environment. And so when there's increased CO2, hemoglobin releases oxygen. So you can imagine in tissues like when you exercise and you create lactic acid, your body needs to bring in oxygen to metabolize that lactic acid, right? So in a situation in tissues where it's more acidic, you're going to release more oxygen from the hemoglobin. And carbon dioxide does the same thing, right? So when there's higher carbon dioxide in the tissues need more oxygen. So hemoglobin then releases or has less affinity for the oxygen that it's carrying. So, I mean, the human body is just incredible how it works.
It's fascinating. It's basically a hyperbaric oxygen chamber in a gel mask, if you really think of it, right? Because
Yep.
that neoangiogenesis is what's taking place throughout all of this. And I love that it's been around since the 1930s, but yet the method of delivery is now non-invasive. They used to
Yeah.
inject it. So now this is great that with all these technologies and these new modalities that you have pre and post procedure to help your patients, and then the outcomes, of course, are so much more rewarding. Now, let's hone in on a few specific procedures, starting with facelifts. So, with an increased interest in facelifts, how have you integrated modern technologies like CO2 lift or even other techniques to improve their outcomes?
I think that's a great question. I mean, there's constant innovation in medicine and also in plastic surgery. Uh, but I think if you take a step back and you think about what really makes the difference, I think it's really the provider, the physician, right? You got to go to someone who's, experienced, who has a lot of insight, who understands what the current science is, what the clinical data shows. And then that provider is going to take in all of the different treatment modalities that can be used and integrate those to create the best treatment plan for an individual patient, right? And as we talked about before, communication is critical about not only what's going to be done, but I spend a lot of time preoperatively talking about what the postoperative recovery is going to be, right? Because I want my patient to really understand each step of the way so there's as few surprises as possible. Now, as we move into the recovery period, there's a lot of things we can do, right? I mean, I think good follow up with your surgeon is imperative. There's things that we can do for incision care and then scar management. And now we're seeing things that are essentially simple, safe, and effective, like CO2 lift that we can apply to skin, to tissue, to incision lines, that's going to enhance healing by increasing blood flow, increasing oxygenation, decreasing the inflammatory response. And that affects things at a few levels. Number one is, I think you're reducing the risk of complications and even small complications like breakdown in the incision or excessive scarring. But I think the other thing we're much more aware of now is patient experience, right? So increased comfort, decreased pain in the recovery period. And having used CO2 lift on a fair amount of patients, I started in the practice in the past year where I was using it when there was a problem, when there was a wound healing problem, because I want to enhance oxygenation in the tissues and really try to help the incision to heal and the wound to heal. Um, and now it's gone to using it in patients uh, at the time surgery's finished to try to enhance not only blood flow and reduce the risk of wound healing complications, but also to try to increase comfort in the postoperative period. And I hear from patients, they'll say, oh, well, after my tummy tuck, the incision feels so much better. It just doesn't feel dry. I find when I apply it, for the first few hours after, the incision feels great. But then as the day goes on, it's a bit more sore again. And then when I apply it the next day, the incision feels great again. So I think that whole idea of really trying to enhance the patient experience in recovery is becoming central in how we provide care for our patients in plastic surgery.
Wow, what a revolutionary product, really, truly. And it's so simple. It's the simplest thing. Now, let's shift to flap surgery, which involves transporting live tissue from one location of the body to another and is often done in reconstructive surgeries. And as for our listeners, flap surgery can be really complex and requires a careful recovery process. healing two sites of the body. How do flaps enhance functionality and aesthetics in these cases? And what steps do you take to help patients recover safely and effectively?
Yeah, I think, flap surgery, I mean, flap's a very broad term to describe a lot of what we do, which is moving some type of tissue from one area of the body to another. What most of your listeners are going to understand is something like a tummy tuck, where we're not only removing the extra skin in the lower tummy, but we're actually releasing some of the upper tummy skin and then moving it to the lower tummy to make things tighter, right? And that in itself is an example of a flap. And if we shift to the other end of the spectrum of flap surgery, which is free flap surgery and microsurgery, where we essentially will take tissue, let's say skin and fat, along with the major blood vessel that supplies it, essentially unplug it from one area. So let's say the lower tummy, and then in breast reconstruction, we'll plug it into a blood vessel in the rib cage to reconstruct the breast, right? To provide skin and volume in the form of fat, right? And so you have different types of flap surgery, and often in these free flap surgeries, you're not only taking care of the area like the breast that's being reconstructed, but you're also taking care of the donor site, which would be the lower abdomen. So you're doing a big surgery and having to manage multiple sites. And again, it's, I think, a similar approach to what we do in aesthetic surgery, right? You're trying to uh, plan an appropriate surgery that's going to have a very good chance of a positive outcome, and you want to reduce any potential for negative outcome. And that, again, goes back to the planning, the execution of the operation, and then also the postoperative care, right? Trying to ensure that the patient has a great experience, trying to make sure that their incisions and their wounds heal without any issues, and then also trying to make sure that pain and discomfort is minimized.
Now, you're also an expert in rhinoplasty, co-authoring the third and fourth editions of Dallas Rhinoplasty and serving as the president of the board of directors of the Rhinoplasty Society, which is an international professional organization for surgeons specializing in rhinoplasty. Can't get any more expert than this. Now, this is especially impressive as rhinoplasty is, in fact, one of the most difficult procedures in plastic surgery to achieve consistently good results. So, as an expert, what new technologies or techniques have you implemented in regard to this area?
For the most part, when patients come to see me for rhinoplasty, they come in wanting to look natural, right? There might be something they don't like about their nose, but they want to achieve a result that's going to fit their face, that's going to complement their facial features, right? They're not trying to get a cookie cutter nose like in decades past in the 70s and 80s, where you went in for rhinoplasty and the same technical maneuvers were done on every patient and essentially created somewhat of a similar result on every patient, and for many patients would look overdone. And so patients come in with an expectation to have a natural appearing result. That's great because it means that it's going to fit their face now, it's going to fit their face in the future. It also means that it's not going to be a nose that's excessively small or exaggerated. And the nose needs to be a certain size to work properly, right? Because we breathe through our nose, and that's really a critical function. And then with that, I think what's happened is technically there's been a shift of what we're doing to the cartilage under the nose. So in decades past, there was a lot more removal of cartilage and weakening of cartilage to create a smaller, pointier nose. Now we're really much more conscious about doing structural rhinoplasty, so supporting weak areas of the nose, maintaining structural support in the nose during rhinoplasty. And we do that through a variety of techniques to manipulate the cartilage. Sometimes it's folding the cartilage on itself so that we're not actually removing it. We can make it a bit smaller, but then it's still as strong. Other times we borrow a bit of cartilage from other areas, sometimes inside the septum, and actually move that to another area of the nose to provide support. And that's really a key to a great long-term result. It's like building a house. If you have a great foundation and frame, you're going to have a great house. If you don't have that, then you're going to notice that things start to go wrong sooner, right? So I think that's
Yeah.
critical.
Well said. Now, serving as an assistant professor and a leader in various professional organizations, why do you believe being educated on the latest trends and technologies, even something as simple as CO2 lift, is crucial in the field of plastic surgery? I mean, not just from practicing health professionals, but also for both students, especially in an era of such rapid advancements.
I think that's exactly it, Zen, is that we need to be up to date. That serves our patients best. There's continuous innovation. There are a lot of things that we didn't do in the past that are becoming really a standard in terms of providing the best patient care. And it's important to keep up to date. And, personally, I've been involved since my finishing my residency in our professional organizations. As you stated, I've been involved in the Aesthetic Society, which is the largest professional organization for board certified plastic surgeons who specialize in aesthetic surgery or cosmetic surgery. I was recently the past president of the Canadian Society for Aesthetic Plastic Surgeons, which is our version of that in Canada. I'm currently the president of the Rhinoplasty Society. And it's very important to be involved because this is where a lot of the innovation is put out to the professionals, right? So this is where the latest science is presented. This is where the newest techniques are taught. And so when we go to these meetings, we get a great opportunity to continue our medical education, to continue to learn and improve our craft, and that ultimately benefits our patients. Also at these meetings, a lot of the innovations from industry are there, right? So like CO2 lift being a new product, it's just it works, it's simple, safe, effective. That's what you want for patients. And if one's not participating within the profession, I think they miss out on a lot of these opportunities to learn about new innovations that are going to directly benefit their patients and improve their patients' experience.
Wow, you have a lot on your plate, president of a lot of different organizations, and I love that you take it with so much grace and just continue to um, educate others because that, of course, will come back full circle. Now, are there any? We have about a minute left. Are there any other emerging trends or techniques that you're especially excited about in the plastic surgery field, and that patients should be aware of as we begin 2025?
Zen, I think there's so many things that can come out from industry and so many different technologies and also in the non-surgical space. In the past year, I've been most enthusiastic about CO2 lift because when I learned about it, it just made sense to me. The science is there, and like I said, simple, safe, effective. Any of us can use it in our practices right away. And so that's the thing I've been most enthusiastic about. With innovation, I think the most important thing for your audience to know still is uh, really spend time doing your research on who's caring for you. Get yourself a good physician, someone who's experienced, someone who's honest, someone who's going to be there for you before and after your treatment, especially surgery. And I think that's the most important thing because if you have a great physician, a great surgeon taking care of you, then they're going to do all of the research for you about what's the best technique, what's the best technology, what are the best, uh, you know, topical products that can be used. But just find that right surgeon to take care of you.
Well said. Well, we are at the end of our date, my friend. I thank you so much for coming on. It was a pleasure chatting with you, very inspiring. And thank you so much for all your knowledge.
Great. Thanks so much for having me, Zen.
That was our Going Deep segment brought to you by CO2 Lift in our Expert on the Microphone series. And that was renowned plastic surgeon Dr. Jamil Ahmad, specializing in aesthetic surgery and rhinoplasty. Be sure to head to rhinoplasty.society.org, which he is the president, and the aestheticsociety.org, where he serves as vice president. And of course, do check him out on the gram at Dr. J. Ahmed. And of course, check out the Aesthetic Society at the Aesthetic SOS right on Instagram. You're listening to A Moment of Zen right here on 710 WOR, the voice of New York, iHeartRadio. We'll be right back after this.
A Moment of Zen is brought to you by CO2 Lift. As we age, our skin loses moisture and elasticity, causing wrinkled skin. You can reverse this aging process with CO2 Lift. CO2 Lift utilizes the powerful benefits of carbon dioxide to lift, tighten, and regenerate your skin. This simple, painless at-home carboxytherapy treatment is scientifically proven to reverse the aging process. You will see reduction in wrinkles, increase in luminosity, and improve pigmentation, sagging, skin tone, and radiance.
For more information or to order CO2 Lift, ask your skincare professional or go to co2lift.com.